Interactive for subscribers. Discover a treasure trove of ancient knowledge. This channel features a series of 248 videos dedicated to amazing healing methods preserved in the Jewish tradition for centuries. Each episode is a separate story, a rare recipe, and a secret that opens the way to health through the wisdom of ancestors. 248 unique healing methods, tested by time. Each video reveals one technique, explanations, and tips for a modern person. Interactive for subscribers. Invite 10 friends, organize 10 likes, and get the opportunity to learn out of turn A. Method of treating an illness that interests you, not yet published. Leave requests for individual topics in the comments to the video. Every Monday, the channel releases a special video dedicated to the joint reading of Tehillim, Psalms, where all subscribers combine their intentions and requests for support, help, and healing for themselves, loved ones, and the whole world. May sincere prayer and ancient wisdom guide you on your journey to health and harmony. Join us to discover the secrets that have been kept for centuries and become part of a unique community where tradition meets modernity. 248 Secrets of Jewish Traditional Medicine, JTM. JTM, Treatment, Bronchitis. Healing Secrets from the Diaries of My Ancestors. Chronic bronchitis is an inflammatory disease of the respiratory tract, accompanied by a long-term cough, shortness of breath, a feeling of heaviness in the chest. People suffering from this disease know how important it is to prevent its exacerbation, prevent complications, and maintain the immune system at a high level. In the old days, when antibiotics were unknown, treatment was based on supporting the body with its own resources. Through the centuries, from generation to generation, my family has kept invaluable knowledge about ways to maintain health and fight diseases. This knowledge is not always written down in medical textbooks. It lives in the memory of ancestors, in the diaries they wrote. The history of medicine has many examples of knowledge and experience being passed down from generation to generation, enriched and improved. For some families, healing becomes not only a profession, but also a part of the family identity, a source of pride and special traditions. I belong to such a dynasty. More than 4 generations of my ancestors dedicated themselves to serving people's health. During this time, our family has accumulated a unique wealth of knowledge, including rare methods that have not found wide distribution in mainstream medicine, but have proven their effectiveness in practice. A medical dynasty is not only respect for the profession, but also a constant exchange of experience between generations. Each new doctor in the family, receiving basic medical education, is sure to get acquainted with the experience accumulated by ancestors. Unusual clinical cases are discussed, diagnostic methods are analyzed, old recipes and methods of treatment are studied, sometimes preserved only in family records. Over time, approaches to treatment change, new technologies and drugs appear, but the value of practical experience does not lose its strength. Sometimes it is family secrets that become the key to recovery where standard methods are not effective enough or are associated with high risks. Ancient method. One of these unusual, but surprisingly effective means is the use of thin sheepskin for the treatment and prevention of chronic bronchitis. The modern world is fast and technological, but even the most advanced medical achievements cannot completely displace the wisdom of antiquity. Folk recipes are not just alternatives, but a harmonious addition to official medicine, allowing you to use natural factors to restore balance in the body. Among the many means, a special place is occupied by methods that rely on the properties of natural materials. Sheep wool is a symbol of comfort, warmth, and care, has long been used not only for sewing clothes, but also as a means of maintaining and restoring health. Fur, tie, for the bronchi. The essence of the method is unusually simple, but this is where its wisdom lies. A rectangle is carefully cut out of thin sheepskin. The size is selected individually so that it comfortably fits the neck and upper chest. This piece of fur is put on with the fur side inward, directly on the body, like a tie or scarf, and is worn under clothing. How does it work? Sheep wool has a number of unique properties. Thermal insulation. The fur maintains a constant temperature, which is important for patients with bronchitis. Cooling the chest area can lead to an exacerbation of the disease. Skin breathing. Natural material allows the skin to breathe without creating a greenhouse effect or causing irritation. A micro-massage. Soft fibers constantly lightly stimulate the skin surface, improving blood circulation and metabolism. A warming effect. Constant soft heat helps to relax muscles, relieves spasms, eases coughing, and accelerates the restoration of the bronchial mucosa. The main task is not only to relieve symptoms, but also to prevent the development of complications. Chronic bronchitis is insidious in its tendency to relapse, and any hypothermia can become a trigger for a new exacerbation. The use of a fur tie helps. Warm the respiratory tract in cold weather. Maintain the therapeutic effect after the main procedures. Create favorable conditions for the restoration of bronchial tissue. Reduce the risk of bacterial complications by improving local blood flow. Soothe coughing, facilitating the discharge of sputum. Strengthen the immune system due to the soft but constant effect of natural material. Tips for use and care. In order for the fur rectangle to be truly beneficial, it is important to follow simple rules. Use only clean, well-dressed sheepskin. Choose a size so that the product does not interfere with movement and does not squeeze the neck. The fur should fit the skin, but not cause discomfort or sweating. It is recommended to wear the tie for at least several hours a day, and during periods of exacerbation, at night. Regularly ventilate the fur, keep it clean, avoid getting wet. Store the product separately from synthetic materials to preserve its natural properties. Scientific view and modern research. Although the technique is based on empirical experience, modern research confirms the importance of thermal conditions in chronic respiratory diseases. Local heat promotes vasodilation, improves the delivery of oxygen and nutrients to tissues, stimulates regeneration processes. At the same time, natural wool does not contain allergens typical for some synthetic fabrics, which makes a fur tie an affordable, safe, and environmentally friendly means of support. The secret of sheepskin is a reminder that the simplest things can become a real medicine. In a world where high technology coexists with ancient wisdom, such methods acquire new value, helping to maintain health. Let a fur tie that warms the bronchi become a symbol of hope and care, a carefully inherited talisman that unites generations on the path to good health and inner harmony. Our other family secrets and approaches. Family practice is not limited to just one method. Over many years of work, the doctors of our dynasty have collected other secrets, including, for example, a use of special plants analogues of antibiotics, recipes for homemade ointments to speed up healing, how to prevent and permanently get rid of bronchitis and reduce swelling, special breathing exercises to support the immune system, effective treatment of shin edema and hemosiderosis in the elderly, effective treatment of various skin diseases, effective treatment of various diseases and injuries of joints and bones, and much, much more. All these methods have been tested in practice and have proven their effectiveness in combination with modern medical knowledge and approaches. The continuity of generations gives the doctor not only knowledge, but also a special worldview. The doctor develops respect for the patient, attention to detail, the ability to see the disease as a whole, and not just what is written in the textbook. Family education in a medical family forms in the future doctor responsibility for every decision, the desire to seek an individual approach, and the desire for continuous improvement. The secrets passed down in our family are not just a set of recipes, but part of the culture of caring for the patient's health, where the person comes first, not the disease. The experience of generations helps to find solutions even where standard methods are powerless or associated with undesirable consequences. It is important to remember, not a single, even the most ancient and proven method, replaces a timely visit to a doctor and a professional medical examination. Family secrets can be a supplement to therapy, but not a replacement. Let the experience of our ancestors and modern knowledge help us to be healthy and take care of ourselves and our loved ones.